America's health care system is in critical condition. In just the past decade, the number of Americans without health insurance rose from 30 to 37 million. The percentage of the poor not covered by Medicaid rose from 35 to 60%. Annual health care spending rose from $248 to $650 billion. The percentage of corporate profits consumed by medical expenses rose from 29 to 49%. The percentage of people who believe the medical system needs fundamental reform rose from 75 to 89%. The crisis in American medicine compels us to look beyond our border. Canada and the United States spent a comparable amount on virtually identical medical systems until Canada adopted national health insurance in 1971. Since then, the percentage of Canada's national wealth consumed by health care has risen to 9% compared to over 11% in the United States. How has Canada managed to cover all its citizens and spend $2,000 per person on medical care, while the United States spends $2,600 per person and leaves more than 1 in 4 Americans without adequate insurance? With soaring medical costs leaving increasing numbers of Americans without adequate insurance, we've decided to look at how our neighbor to the north has seemingly achieved such an equitable, efficient, and popular system. The purpose of our comparison is not to suggest that we could or should transplant the Canadian system to the United States. Indeed, we will reveal serious shortcomings in Canadian medicine. Nonetheless, an open-minded comparison can expand our vision of how to reform an American health care system that is truly in crisis. During the next hour, we'll follow U.S. and Canadian obstetric, cardiac, and cancer patients who have similar medical needs, but vastly different encounters with their health care systems. We begin our investigation with a look at the experiences of women giving birth on both sides of the border. In Canada, where the government picks up the tab for all medical expenses, 95% of women get prenatal care in their first trimester of pregnancy. In the United States, where care is routinely denied to people who can't pay for it, only 75% of pregnant women get prompt prenatal care.